Genital warts are benign growths that multiply, occurring in the genital and anal areas as well as tissues close beside them. They are common and can affect you at any age, but happen most in young people in their early 20s. What causes them? They happen due to an infection with the human papillomavirus HPV, specifically the low-risk genotype strains 6 and 11, which are different from the high-risk HPV strains that are associated with developing cervical cancer. Even though they are benign and very unlikely to cause severe life-threatening illness, their location in intimate areas and the way they grow and spread can lead to a lot of discomfort, embarrassment, and distress, especially when you're trying to get rid of them. They're most commonly spread by sexual contact. So if you have anal or vaginal sex, or sometimes oral sex with somebody who has HPV infection or genital warts, you can catch them. You may also get them from sharing sex toys. Sometimes they can be spread from warts on your partner's hands, or very rarely from a mother to her baby during delivery. The diagnosis is usually by a physical examination where the warts can be seen on the skin and they can have the following characteristics. They might happen singly or in groups of more than one. They can develop in areas of high friction. In other words, where there is a lot of skin-on-skin rubbing or skin rubbing against clothing. So, along the genitals, in between the thighs, along the anal area, between the buttocks, and so on. They can look soft and fleshy when they grow in moist, warm areas, or firm if they are growing in a dry, hairy part of the body. They can look the same color as your skin tone, but in some cases they can even appear lighter or darker than your skin. Many of the warts grow close to the skin with a broad base, while some may have a slight stalk connecting them to the skin. And sometimes they can be confused with other lumps or lesions that look just like warts. And so doctors will have to take a little bit of tissue known as a biopsy to examine them closely and work out which is which. We don't diagnose genital warts using blood tests or scans. So now let's come to the purpose of this video, which is the treatments for genital warts. Before we start, it is always best to see a medical professional if you think or suspect you have genital warts. And this is because whatever treatment option you decide to go with, it's essential to test for other sexually transmitted diseases which you may have at the same time, but they show up later and will require a different sort of treatment altogether. So first, option 1 is no treatment. This is doing nothing, leaving the warts alone. This option is often discarded as unimportant, but 30% of warts that you see actually disappear by themselves within 6 months of developing. The problem, of course, with this method is that 6 months is a long time to wait, and having those warts while you're waiting can affect your body image and affect your sexual relationships as well. So next are the more common or favored options. These are skin preparations that are applied as creams, ointments, or lotions to the skin. There are a few of them. Some can be self-applied, although if you have warts covering a large area, you may need help from your doctor or nurse to apply them for you. In this category, we have Podophyllotoxin, Imiquimod, or Sinecatechins. Let's begin with Podophyllotoxin. You will find this available under several brand names. Using this cream needs medical supervision if you're treating genital warts in women and men if they have very large warts. And this is because your doctor or nurse can help you with the precise location of the warts and where exactly to apply the treatment when you get home. It comes as either a cream or liquid preparation. The treatment with this is usually for 3 days every week for a number of weeks. The number of weeks or courses that you will have to take the treatment will depend on the nature and the extent of your warts, and your doctor will be in the best position to advise about this. So let's look at some of the side effects that can happen. The cream can lead to skin irritation, which may develop on the second or third day after you start treatment. This irritation is mostly mild and it will go away when you stop using the cream. However, sometimes the irritation can become quite severe and some people may develop sores or ulcers on their skin. Please be careful not to apply this cream on open wounds or even normal skin, and avoid getting the cream on your eyes or around your eyes when you're using this treatment. Also, watch the amounts you're using. Thin applications are best because applying the cream on excessively doesn't get the condition better any faster and increases your risk of serious complications like kidney damage, bowel problems, and much more. Finally, pregnant and breastfeeding women should not use this medicine. So next, let's look at Imiquimod, which also has different brand names depending on your location. The duration of treatment with Imiquimod is lengthy, up to 4 months, and this is while using the cream 3 times a week and usually best at night time. You apply the cream directly onto the warts, not on normal skin, rubbing thinly into the wart tissue and leaving the cream on for at least 6 to 10 hours, which is why it's best at night time. Afterwards, you need to wash the cream off with mild soap and water. It's also important to have medical supervision when you're using this cream so that you know exactly where you are putting it on at home, and it is not meant at all for internal use. The best way is to continue using the cream until all the warts you can see have disappeared, but it should not be used for beyond 4 months altogether. Common side effects include redness or irritation and pain around the warts, because Imiquimod very quickly stimulates your immune system just after a few applications. If that happens, stop using the cream until the redness settles, and then you can gradually restart the cream, this time using it once or twice a week instead. Other side effects are joint and muscle aches and headaches. Less commonly, they can lead to irritation of other tissues, diarrhea, and mood changes. Imiquimod may also lead to permanent color changes to your skin, in some cases bleaching or darkening the skin in the area where it's been used. Please read the accompanying medication leaflet to learn how to use it and its potential side effects. When you have genital warts, ideally you should abstain from sexual intercourse until your treatment is over and the warts have completely cleared. If this is not possible, please use condoms. However, be careful with Imiquimod cream and latex condoms or vaginal diaphragms, because Imiquimod can weaken or damage them and make them ineffective. The other thing to remember is avoid having sex while you have the cream on, because it could irritate your partner's skin. And the third wart cream we're looking at today, that can be self-applied for external genital warts, contains the green tea extract Epigallocatechin gallate, also known as Sinecatechins. Watch out for different brand names where this product might be sold. So the Sinecatechins are applied thinly by hand over the particular wart lesions, and there is no need to wash it off after application. Treatment should continue until the warts have all cleared and should not continue after 4 months. The Sinecatechins can also cause skin irritation. Be careful not to use it over normal skin and to have sex while you have the cream on. This one could also weaken latex condoms or vaginal diaphragms, so you will need to wash the cream off if you intend to have sex using condoms or diaphragms. When you're using any of these active skin treatments for treating genital warts, please remember the following. First, they can take between 1 to 6 months to work, so you have to be patient. Some people may see some improvement within 4 to 5 weeks using the Podophyllotoxin or Sinecatechins. But for Imiquimod, it may be 2 to 3 months before you start seeing any benefits. If there is no response after using the creams for these periods, you should stop these treatments and seek some alternatives. Number 2, they may not be very effective, especially the first time around, and you might need more than one course of treatment to eliminate an outbreak of genital warts. Number 3, even after completing these treatments, genital warts can come back. In other words, you might experience a relapse, and this is because these creams do not eliminate the human papillomavirus. And number 4, please remember that these skin treatments in some cases can cause some discomfort or skin irritation. I know I've said this before, but using condoms is important if you can't abstain while you're on treatment. Be careful with the creams that could affect the effectiveness of your condoms. Additionally, if you smoke, stopping can improve your response to the treatment. So now let's look at the treatments that require a professional or specialist or somebody who's trained to be a lot more closely involved in delivering them. And these might be options if you've used the ones I've mentioned that there's been no response for months, or you've developed side effects, or the warts are extensive. There could be different reasons why you might have to go on to use these other treatments. The first is a liquid solution that is applied to the skin, which is known as TCA or trichloroacetic acid. This needs a specialist to apply to the wart lesions. Next is cryotherapy or freezing, which involves applying liquid therapy to the warts themselves. A blister forms and eventually they fall away. Freeze treatment can be painful and it might need to be repeated a number of times before it's effective. Another method that warts can be removed is by surgery to cut them away from the skin using local anesthetic to numb the area beforehand. Alternatively, there are electric current, laser or heat treatments that can be applied to the warts to achieve the same goal, that is to remove the warts. These are quicker treatment options clearly, but they can also have side effects such as pain, bleeding, scarring, soreness and irritation of the area. A mention for pregnant women with genital warts. They are not harmful while you're pregnant. However, they can get bigger. They can be more uncomfortable, inflamed or irritated, or, and this is very rare, they could be passed to your baby during delivery. Now, most treatments for warts are not recommended in pregnancy. So unless they are very big, we will not do anything until after you've had your baby. And at this point, the warts will usually disappear by themselves within 6 weeks of baby being born. So any treatment is usually delayed to see whether they will completely go away by themselves or started if they have not. So this is how genital warts may be treated. It is possible that if you have a very healthy immune system, you may be able to completely eliminate the warts and the HPV from your body within 18 to 24 months. But sometimes they can come back. So I'll leave you with a few last thoughts when it comes to genital warts treatment. Please don't go using over-the-counter creams like salicylic acid creams or glycolic acid creams or other common plantar wart or verruca treatments. They don't work for genital warts. Genital warts also do not respond to antibiotic treatments. Please don't try to scrape them off or scratch them off by yourself at home, because that can lead to infections and it doesn't work either. Lastly, remember that there is a period of time from when you get infected with HPV to when you develop warts on your body. In other words, there is an incubation period after the initial infection with HPV, when the virus is growing in the body before the warts start to show in the skin. Many people whose partners develop genital warts may suspect that their partners are cheating because they see them just developing genital warts. But in fact, they may have been infected for several months or weeks and the warts are only just showing now. The incubation period between when you are infected by the HPV and when you develop genital warts does differ from one person to another, but it tends to be shorter in women than in men. That's all I've got for you now. Thank you so much for watching. Let me know if this provides a bit more clarity when it comes to genital warts treatment, because I had a lot of requests regarding this particular topic. Give this video a like if you found it helpful, and please consider sharing it with a friend. Don't just leave the channel, check out our other videos on vulval and vaginal health, and I'll see you again soon. The duration of treatment for Imiquimod.